Oh. Hello, good evening.
Hello.
Yeah,
Go ahead. Go ahead.
I joined this video call through a link. Can I have an idea of what the meeting is all about, please?
Yeah, I'm Dr. John Bennett. What's your name?
I'm Dr. Shitu.
Okay, where are you from?
I'm from Nigeria, Kwara State.
Welcome. This is a webinar, just like any medical webinar in your hospital or your school. It starts in about 20 minutes, and the doctor is going to be lecturing on a transphenoid approach, I believe. So basically, he presents just like at a conference with a PowerPoint, and then after a little discussion.
Okay.
And it's all recorded. It's televised live. It's on the internet. It's on the internet on Neurosurgical TV.
Okay.
Across the world.
Okay. Thank you very much.
Yeah, well, it's a good tool for teaching.
Okay.
As you know, you can never get too much neurosurgery.
Oh, that would be lovely.
Yeah, you're welcome. And we welcome the Nigerian community. We
Oh,
had a Nigerian presenter a couple of weeks ago,
oh, that's interesting.
and you are welcome to present when you're ready for
Oh.
African Grand Rounds too.
Okay.
Okay.
Thank you. Thank
Sure.
you very much.
Okay. Do I have your
But-
email? How'd you find out about this? Do I have your email or?
A doctor friend referred me through WhatsApp.
Oh, great. Send me your email. You can text it in the chat. There's a chat room here. Just text your email address and I'll put it on the African Neurosurgery mailing list.
Oh,
Okay, can you write your email address, please?
I'll do that right away.
Yeah, just give me your email address before we're through. And I put you on the list and you receive all notices with the link to come in like we did today. You came in with the link, right?
All right.
Did you get in through the smartphone? How'd you get in? How'd you get the link?
I go through a smartphone through the WhatsApp messenger on my phone. I just follow that link.
Yeah, good. Okay, good. You did it right. Okay, I'll be back.
All right, no problem.
Zolo, are you there? Where's
Hello,
Zolo?
Dr. Ben. Yes, I'm there.
Okay, you got no video today, right?
Uh,
You don't have to worry about it. Don't worry about it.
I'm going to put it on, but not now. Like, I'm just waiting for a while.
Okay.
So how has it been?
Oh man, we had a great webcast this morning.
Chinese presentation, how was it?
Well, that was well. It went well. And they want to do it every week. They want to do it every week.
Cool. They're cool. It's a good idea.
Yeah. And this morning, with IPE, you came for a little bit.
Yeah.
Yeah, IPE, that was a tremendous presentation, but he's a world famous guy. You know that.
It's a tremendous presentation. You are using Donald Trump's vocabulary.
He attracted people.
Yeah, a lot of people. Like it was a tremendous presentation. Yeah.
Yeah, here's Landry now. How'd you meet Landry?
Not personally. I've not met him personally. He's a master of Dr. Natley. They are working together.
Oh, good. He's in the Ivory Coast?
Yes, in Ivory Coast, yeah.
Oh, excellent. Excellent.
She's actually the person who told me that he would like to do a presentation. So I just scheduled him,
Yeah, great. Yeah. 1, 2, or 3, whatever. Sometimes people want to present, so that's fine. Yeah. Okay, I got your email, Simeon. I got your email.
He's around already. Dr. Conan Landry is around, so I think you can get started with him, like on how to make the presentation. The screen sharing and all the rest.
Okay, maybe. Hello, Landry.
Hello.
How you doing? Yeah, I can hear you. I'm Dr. John Bennett.
I'm doing good.
Thanks.
Okay.
You're taking care of Natalie. Are you there, Landry?
Yeah.
Watch out, she's a devil.
Yeah.
She's a devil, man.
She knows how to moonwalk.
The only nurse. Well, I know an ENT doctor that can moonwalk, but I never met a neurosurgeon that can. Zolo, how many neurosurgeons in the world can moonwalk? Do you know of any?
I think only Dr. Natalie can moonwalk.
He's the only one I know.
Yeah, she's the only one.
We'll have to bring that up at a conference.
Okay. Hello, Dr. Conan Landry. How are you doing today?
That's Zolo. Landry, do you know how to screen share yet, or do you want me to show you?
So, issue with my internet connection, so I want to try with my my smartphone.
Okay. Okay.
Hello.
Yeah, go ahead, Zolo.
No, Dr. Landry is speaking.
Oh, okay. He's gonna use his smartphone. Was he taught how to screen share, or should we do it now?
Hello.
Okay, Landry, hi.
Hi.
Yeah,
Do
you
you
want me?
hear me?
What? Yeah, you want me to show you how to screen share your PowerPoint?
Let me try to see.
Okay.
Um,
You click the share.
if I
There
do
you go.
that,
There you go. Now pick a screen. There you go. You got it, man. You're fast. You're not as dumb. You're not as dumb as Zolo.
Perfect. No, he's not as dumb as me.
it's my first time even to present on any kind of online conference. So I'm a little bit
you can make the screen bigger. Okay, you know,
okay.
Could you explain, Zolo?
I think Dr. Ben, you should. I think you're a better place to, like
know,
you. Okay.
Okay. So what I want to do is, sometimes I will switch screen from PowerPoint to Photoshop.
Okay.
So I just want to be sure that
it's the same principle. It's the same principle. You just
I have a
share the
Mac.
PowerPoint screen.
Here, can you see my?
Yeah, I see conclusion.
Yeah.
But
we
you
see
need to make the
conclusion.
screen bigger. You need to make it
Yes.
bigger.
Déjà,
Let me
docteur, est-ce
try
que
to
vous pouvez
make it
faire projection de diapo, projection,
like
oui,
this.
là, oui, là, there, perfect. So it's going to come on,
There,
yeah,
there you
oh,
go.
perfect.
You got it. You can
So
see
this-
it, right? That's what the internet sees,
Yeah.
what you see now.
Yeah.
Okay.
Hey, Ulrich. Hey, man. Ulrich's here. Great.
Dr. Ulrich is around.
Great.
That's great, man.
I try it out, but I don't know. Hello?
Oh, beautiful.
Yes,
Beautiful.
that's
Beautiful.
wonderful.
Yeah, beautiful. Hey, Ulrich, are you there?
Hey, John. How you doing?
Welcome back.
Hey. So how you doing?
Good, man. It's going great.
Hello, everyone. Hello, Zolo.
Hello, Dr. Ulrich. Hello, Dr.
Yeah.
Ulrich.
You're doing a great job.
Thank you.
Yeah, Zolo's helped a lot.
Yeah. I trust him. You know, I'm sure he can handle everything.
I wouldn't trust him with my sister.
Hey, Dr. Conan. So nice to have you on the platform.
Nice to meet you.
Yeah, Dr. Conan, to save bandwidth, when you start your presentation, get off the photo. Like it says stop video at the bottom. You see that screen? Or maybe you could explain it, Zolo. To save bandwidth. Okay.
Yes, Dr. Landry, yes, like when you start sharing during your presentation, if you like the bandwidth to be better, you just off your video. Like there's a small camera down, you press on it, it's going to become red, then you can present better. It's going to the internet is going to be better than when the video is on. Is your case? Can you try? I think it's doing. Dr. Landry. Thank you, sir.
Well, actually, I don't know. Stop video.
Okay, Dr. Ben, I'm going to do some promo again and I'm coming back.
Okay. Yeah, that's a good screen. Now, can you get off the PowerPoint for a second, Landry? The way you do that is you go to the top and you put stop PowerPoint. Do you see that, Landry? Okay, I can bump you off there. You know how to start it again, so. I'm just taking you off the screen share there. Okay, look what I do. Landry, are you there? Or you go off? Okay, I think he's switching to his smartphone. Ulrich, you gotta come, you know, IPE is having daily neurosurgery chats. Because a lot of neurosurgeons are idle now. They're open to looking at video platforms.
Yeah, I saw that.
You doing okay, Ulrich?
It's all right.
Yeah.
I guess. Yeah.
Okay, getting by, huh?
Yeah.
Well, we'll talk later. Let me do some things here first.
Is everything set already?
What do I want to do? Okay. Okay, we're at 6 minutes.
Non, d'habitude, tout son ici. Oui. Quelqu'un a fait ça.
Zolo, are you there?
Yes, Dr. Ben, I'm there.
Yeah, I'm going to give you a link to share around. It's like
Okay.
a YouTube link, which is the live link,
All right.
and just share it around because it's a lot. It's a live. You get. Oh wait, no, that's not it. That's not it. Hold on. Let me get that.
Hello?
Hello. Somebody
Yes.
Hello.
there.
Yes. Are you there, Landry?
Yeah. Unfortunately, they cut electricity just get us a
Oh.
couple of minutes to go.
Oh,
So now I'm using my phone connection as a
Okay.
modem.
oh,
I
okay.
think it's okay.
That's Africa.
So
Are you using that as a modem, the smartphone?
yeah, I'm using it as a modem.
Oh, good, good. You know what you're doing, huh?
That's Africa for you. Yeah. You spend the last week doing season light. Electricity every day, and you could spend 36 hours without electricity, and
And
when they give it back for 3 hours, don't only. So
In
it's very
in Cameroon, right?
yeah, booyah, especially.
In Ivory Coast too?
Yeah, but it's not frequent. I don't know why today they're doing that. It makes me more nervous.
Hey, Nathalie.
No, you got it, Dr. Landry. It's going to be okay.
Hello, John.
Hey, how you
Hello,
doing?
I'm good, and you?
Good, good. Welcome.
Thank you. Hello, Dr. Hey, Eric, you're there. Hello, Dr. Landry.
Hey, is
It's
everything
been
all
long.
right? Yeah, with
The hair's looking good.
Yeah. Just come. We're waiting for the presentation.
as long as you stay home, it's okay.
Yeah. Hello, Dr. Marco. I think.
Yeah, he just came in here. Mark, are you there? There you go.
Hi guys, how are you?
Hey, look, Ulrich's here and Natalie's here.
Yeah, finally.
The dream team is there.
Okay.
Okay, we got 2 minutes. 2 minutes.
Yeah.
So usually how long it takes? 30 minutes, an hour?
Well, however you want, however you want, whatever you feel comfortable with. Then usually after, we, you ask questions if people want to ask questions, or sometimes people get in and they show something. They say, oh, I have, an MRI of this or something, sometimes. But generally what we do is introduce the panel first, the people that came, and then we introduce you. And then you talk about yourself, what you do, what year you are, and then you talk about your presentation, and then you go on to the PowerPoint. And after, you just ask people if they have questions. Or I ask them. You don't do that. You just present your PowerPoint.
Okay, awesome.
Okay. Now, how big is Ivory Coast residency? How many residents are there? 2 or 3 a year, or how many?
Recently, Natalie is in the new group.
Oh,
I think
good.
you are 7, right? Natalie? Or more?
Something like nine.
Oh, that's a lot. In 1 year?
Yeah, for this
Yeah.
year. There's never been like that.
Wow, that's a lot. Wow, that's
Yeah.
great.
Yeah. So I think there are among 30 residents, 30 to 35 residents. I don't have the exact number, but some are overseas right now for a fellowship. We have one, I think, 2 in France and another one in Belgium.
Oh, okay.
So our residency typically lasts 5 years. And after that, we send our fellow, our resident overseas. Usually it's either Belgium or France.
To France?
Yeah.
Okay.
We have several, because our official language is French. So we have these agreement with several hospitals in France. So they go there and they stay typically 2 years.
Okay.
So either they graduate before going, or they finish the fellowships and they come back to graduate.
Okay. Now, Conan, if there's an internet problem, just hang in there and you may have to reboot or come back. You know what I mean? If there is, don't worry about it. Just hang in there and be patient. Sometimes it's just a temporary slowdown. But if it's more, that's okay. You just come back in. Come back in with the same link that you have. Okay? Okay, we'll get ready to start. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good afternoon from Miami Beach. This is Dr. John Bennett broadcasting for Neurosurgical TV. It's the home of Neurosurgical TV. We are graced with the presence of Conan Landry. He's a neurosurgery resident from Ivory Coast. A resident, I'm sorry, I didn't find out if a resident or attending.
No, it's sorry, John. Let me do the introduction. Sorry. Hello everyone. I'm Ulrich Sidney, the president of the Association of Future African Neurosurgeons. Today we have in a lecture series, Dr. Landry Conan was an attending from Ivory Coast at the University Félix Houphouët-Boigny, and we have a few members in attendance. So before Dr. Landry Conan starts the presentation, we're going to go around, have everyone present themselves.
Very good, Ulrich. You did not forget.
So Dr. Marco Meloni, can you present yourself, please?
Hi, Ulrich. Hello, everybody. My name is Marco Meloni. I'm a consultant neurosurgeon in North Italy, Gravedona. See you again.
So happy to have you, Dr. Meloni, as always. Dr. Natalie Gomsi, can you present yourself, please?
Hello, I'm Natalie Gumsey, PGY1 at the University of Félix Houphouët-Boigny. I'm also a member of AFAN, the Secretary General of AFAN, and I'm happy to be here. Thank you.
Welcome,
We're happy to have you, Natalie, as always. Dr. Marvin Topmini, can you present yourself, please?
Yeah, hi everyone. I'm Marvin Topmini, postgraduate year 1 neurosurgery in Ivory Coast.
Oh, fantastic. Dr. Musindo, how are you doing?
I'm fine. Hello everyone. I'm Augusto Jacinto Musindo Alberto. I am resident of Neurosurgery in Mozambique, Maputo Central, Africa.
Nice to have you. Boniface, I'm not sure of the second name. Can you unmute yourself and present yourself, please?
My name is Boniface Kivevele. Can you hear me?
Yes.
Yes, we can hear you.
Okay, thank you. I'm Boniface Kivevele from Tanzania. I'm a neurosurgical resident through COSEXA. This is my 6th year. I think this is the last year. So thank you to join the session.
Oh, nice. So Tanzania, Dar es Salaam at Muhimbili?
For the time being, I've been at Aga Khan, Nairobi.
Okay.
For my training because of this, the current situation of the coronavirus. So we have been asked not to be away from the training institution. So now I'm back at my home country.
Okay,
However,
nice to have you.
Yeah, okay, thank you.
Thank you so much. Mayan K, can you present yourself, please? Can you unmute and present yourself? Maybe not. Okay, no worries. And the very studious Zolo Ivan, who's been running the show for a while. Can you present yourself, please?
Thank you very much. Hello, everyone. I am Zolo Ivan, a CTA medical student from the University of Buea in Cameroon. It's a pleasure and an honor to be here. I'm a member of Association of Future African Neurosurgeons. Hello.
Okay, thanks. Now we can give it up to Dr. Landry Conan. We're so happy to have Dr. Landry Conan. He's, like we said before, he's an attending from University of Félix Houphouët-Boigny, neuroanatomist, neurosurgeon, and member of the Young Cans. So we're so happy and proud to have him here. Well, Dr. Landry, it's all up for you.
Like, electricity stuff. Hello. Okay.
Yeah, you can start your presentation, Dr. Conan. If you can,
Hello?
please, yes, can you please introduce yourself, then share your screen?
Introduce myself. Oh,
Yeah.
okay. So does everyone sees me now?
Yeah, we
Okay.
can see you.
Yeah, we can see you.
Okay, so I'm Landry Conan. I am neurosurgeon, assistant professor of neurosurgery here and anatomy. So
I'm so sorry, Dr. Conan. I'm sorry. Just
did you hear me?
the problem is the connection is a bit slow. So what we can do is, if it's okay with you, just for a few minutes, we'll send you an email address so you can send your PowerPoint presentation. We can share it from somewhere that has a better internet connection, and that way we'll only have your audio feed and we can follow what you're saying. Right now it's breaking. So we'll just text you I'll text you my email address. If you can send me your PowerPoint presentation, I will just be changing the slides for you if it's okay with you.
Well, it has a lot of
images.
It has a lot of images, so it may be a little bit heavy.
Okay, okay, no worries.
I don't know, I can do that right now. Maybe I can send it through WhatsApp.
Yeah, sure.
Yeah, we'll just edit this out. Don't worry.
Let me text you.
Yeah.
Just a temporary delay.
Yeah, if it was possible, for example, maybe to also cut his video, it will better of the bandwidth.
Yeah, so I just texted you, Dr. Conan, on WhatsApp. If you can send me the file here, and then I can share it from here. So while that is done, yeah. So John, you were speaking about all your recent initiatives.
Yes. Yes. This morning Sherian, MD, a neurosurgeon from Nepal. He's the head of the Asian Congress of Neurosurgeons. He's been giving a daily lecture on neurosurgery. It's called Daily Dose of Neurosurgery. This morning we had an excellent presentation by a big endoscopist, Chandra Diapujari, about the introduction to endoscopy, and he's going to continue that tomorrow at.
Is it your number?
No. At 5 o'clock. Okay, go ahead, Landry. Are you okay?
Oh no, that was me, Dr. Conan. I just sent you a messages on WhatsApp. So I will send you my email address, and you can send the presentations on WhatsApp too.
Okay. Please go ahead, John.
Oh, okay. Did you send the presentation on WhatsApp?
It's 1 megabyte. Try to reduce the size.
Yeah, go ahead, John.
Yeah, and it's going to be a daily presentation at 5 o'clock India time, which I think is around 1:30 Cameroon or Africa time, West Africa time. It's going to be a different topic every day. And we're going to get some of the best neurosurgeons in the world. IPE is getting them because, as everyone knows, a lot of neurosurgeons are at home now and they have time. They have time to participate in video conferences. So hopefully we'll get some diverse array of neurosurgeons presenting on different topics, but we're going to take it obviously one topic, one theme at a time. This week seems to be endoscopy most of the week with Dr. Diapujari. He's an older gentleman. He's a well-known Indian neurosurgeon. And I think if you mention his name to anybody in India in neurosurgery, they know who he is. So he's a really good teacher too.
Okay. Dr. Conan, I sent you my email address. Have you sent the presentation already?
No, I told you I'm getting connected from my phone. So
okay, no worries.
We're going to try a different computer.
Because it's over.
Okay. So if you we can always start, but you will have to cut your video feed. So if you can click on stop video, that should help with the audio so we can follow you while you're presenting.
Okay, so if I turn off the video, I can still share my screen.
Yes, you
Okay,
can.
okay.
Yeah.
We won't see you, but we will be able to hear you much better.
Yeah, okay, I prefer that.
Look at me, Landry. I'm going to turn off my video now. Look at me. You see how I turned it off?
Yeah, he's done it. He's done it.
Okay. Okay, good.
So now we can hear me well.
Yes. We can hear you
perfect.
Better.
Okay.
You can share the screen now.
Okay. I'll share my screen.
Yes, perfect. Yes.
Okay.
Yeah, we can see it. Can you put it in presentation mode, please?
Yeah, that's what I did. Do you see it?
Yeah, endoscopic endonasal transsphenoid. Oh, perfect, perfect, wonderful. Well, you can start, Dr. Landry.
Okay.
We're listening.
Okay. Thank you, everyone, for being here, for saving your time. So today I want to talk about a topic that I really enjoy. It's about using the endoscope. And so the title, as you see here, is endoscopic endonasal transsphenoidal approach to the cellar. Usually people say just EEA, endoscopic endonasal approach, but I prefer to have transsphenoidal because we can do many things through the nose, not through transsphenoidal approach. So today, let me start by saying that this is a very old technique using a transsphenoidal approach. But what is new is the use of endoscope. Before that, we use microscope to get through the sphenoid sinus. So the use of the endoscope is sometimes I would say telescope, because what it really do is it show you, like it project your eyes into the field. So it's an indirect view. You look at your screen, but you have a better and a wider field of view. So as Dr. Bennett just said, there is a trend on talking about endoscopic approach right now. So I'm following the trend. So endoscopic endonasal transsphenoidal approach is a multidisciplinary approach. ENT use it, skull-based neurosurgeon use it. So the way I see transsphenoidal approach is that the sphenoid sinus is like a hub in which you can have access to the anterior fossa, the middle fossa, and the posterior fossa of the skull base. So it's a really versatile approach which you can combine even with a transcranial approach, but mainly you can see all the skull base, midline skull base from the front. So I will use this outline to through my discussion, and I will go through topic anatomical, recall. I will go on detail or something. I will go on detail again. Indication, surgical techniques is mainly how I do it, and we will have a conclusion remark. So for anatomical remark, this is what we are going to talk about. Use the endoscope through the nose, through the sphenoid. You see my mouse. Can we see it?
Yes, yes.
Into the sphenoid sinus. So this is a basic about osteology of the nasal fossa. The bone here in green is the ethmoid bone, the vomer bone, and sphenoid bone. So the sphenoid bone mainly here in the middle is the sinus, and the clivus, which is located a little bit lower. So this is a strict midline view on the sagittal plane, but here when you go parasagittal, I mean on the lateral wall of the nasal fossa, you will see classically the inferior turbinate the middle turbinate, the superior turbinate. The turbinate be landmark when we want to go through this approach. And obviously below you have the palatine bone, which is part of the maxillary bone. When we go from the bone to the mucosa, we see the mucosa is very important as it has three main arterial anterior, three, it's usually
Hello.
Just hang in there. We'll see if it hopefully improves.
Okay. So the next slide goes through a coronal plane. So in the middle, show you in the turbinate, middle, and talk a little bit. So first, you need to see is quite really usual. So when an opportunity in our anatomy, we show you.
Well, it looks like it's a bad connection. Let's try it again. Maybe it'll get better.
Yeah. Unfortunately, it's.
Yeah. Hold on. Let's try it again. Maybe it'll work.
Yeah, we'll wait.
Yeah.
We'll all wait.
Don't worry. We can always edit this out.
Okay. Can you see?
Not yet. Can you guys see?
No, can't see the presentation yet.
You're not screen sharing, I don't think.
Hello? Here?
Yes.
Can you
yes,
see?
we can. Yes. No, we can't see yet.
Okay. You can see I'm playing a video, a short video.
Oh no, Dr. Landry, what you would need to do is when you're sharing, share the screen
Go
for
back.
the video. So when you click on share screen, right? You have a few options. Just make sure you click on the video, not on the PowerPoint or any other thing.
Okay, I type like this and I go on a share screen.
So the video should be open already. Yes. Now we can. Now you're sharing your screen. Yes.
And I go again on presentation mode.
Yeah, perfect.
Is it okay? Okay. So let me before.
I don't think a video is going to play. We'll try it.
It is playing right now.
Yeah.
You don't see?
Oh no.
No. It's that eats a lot of bandwidth. That will not work for sure.
Maybe it's better to avoid the wall monitor visual. I think you save some byte, right?
Okay. I have some image too that I can use.
Yeah. Okay.
So
okay.
Okay. Let me go back a little bit. So how to? Okay. Yeah, so here I was talking about on the coronal plane on the CT scan, you see the middle turbinate, and laterally you had the bulla ethmoidalis. So what we used to do here in our team is like we just break this ethmoidal bulla. So when we break it down, it gives us a little bit more space to see the ostium. So that's what I'm showing here. So here we have the lateral wall, and we go laterally to the medial turbinate. So the medial turbinate here. So when we go laterally, we see the bulla ethmoidalis that we can break. and it gives us additional room so we can displace the middle turbinate to the lateral side. And we will see on the next. Okay, so as I told you, but sometime I had some picture for the left nasal fossa, sometime on the right, but every time I tried, here is on the right side. So you see when you get your endoscope to the right side, the anatomy that we see on the right will be the nasal septum. And laterally, we will see the inferior turbinate. So usually it will be all stuck together. You don't really see the corridor to go through the nose. So what we do is we put gauze that we soak in with a mix of adrenaline or xylocaine with nafazoline. I will show you a picture. So it helps us to have a better visualization of the mucosa because of the congestion that we have here. When we put the gauze between the nasal septum and the middle turbinate, it gives us, after waiting for 5 minutes or so, it gives us additional space to navigate through the nasal fossa. So when we have our endoscope, I prefer that we go straight to the very low aspect of the field. So on the very low aspect, we go straight down, we go deep to the posterior rhinopharynx. So we will see these anatomical mark that is the anterior arc of the sphenoethmoidal recess that I show you here. Okay, so we put our endoscope.
Come on.
Literally infinite inferior, the middle turbinate, and medially we see the nasal septum. This is critical to see because what we'll do is because this arch deep. Because when you see the sphenoethmoidal recess, you just go up a little bit for like 1 centimeter and half, and you will find the sphenoid ostium, always. And this is a critical landmark also because from here, under the mucosa, at the mid distance between the inferior border, so the arc here of the sphenoethmoidal recess that you see here, if you consider the distance between that and the ostium of the sphenoid that we will see on another picture, you see have the sphenoid artery that go within the mucosa at the mid distance. This is very critical to remember. When you have a bleeding, you just here and you can use your bipolar to or when you get to the next, okay, ethmoidal recess. This is all these complex. This is bone structure covered in the so when it's at the ostium and the anterior border of the rhinopharynx here at the mid distance, there is
sorry to interrupt you, Dr. Landry. Unfortunately, it seems the connection is breaking a lot, and unfortunately, we have a hard time following what you're saying. It's breaking up a lot.
Okay. So
is there any way you could change computers? Is there any other computer around?
I think the problem is the connection, not the computer.
Whatever.
Why not? Why not? Maybe reschedule it. They were. I
Yeah.
don't know. Connection is better because the presentation seems interesting, but we can't get much.
Yeah, I think it's probably the best choice to do. Unfortunately, I don't think it's going to get better. I don't think it's going to get better.
I don't know what
Unfortunately.
Dr. Landry.
Does anyone else have a presentation prepared? Probably not. Probably not. Probably not. That's all right.
Hello, Dr. Landry. Yeah.
Yeah, electricity just came back, so I don't know. I think it's gonna be better now.
Okay, let's give it a try.
Yeah, let's go ahead.
Please, Dr. Landry, can you step back from your on your
Slide.
anatomy, the second slide of the osteology, nasal osteology. I think from there we didn't get you very well. We had the introduction, but after that it was a little bit.
Oh, wow.
Can you use a smartphone as a modem? Or that doesn't do anything?
No, I use
the connection is not very good.
Okay. Can you see?
Getting there. Okay, we can see it.
Yeah.
So I was saying that this nasal.
Oh boy.
So I will go. This I was just showing the different.
Yeah, this is. I don't think it's going to work, guys.
Yeah, it's very difficult to
yeah,
follow.
I don't think it's going to work at all, unfortunately. Yeah, we can reschedule it unless no one else has. Yeah, no one has a presentation, right? So that's the only thing to do.
So what we can do is, Zolo, you can be in touch with Dr. Gomsi and Dr. Conan and try and reschedule and communicate the date as early as possible, so that everyone, because this is a very important and very interesting lecture and presentation. Everyone's trying to get a piece of it. Unfortunately, the connection doesn't allow us to.
Yeah. Dr. Marco gave, I don't know what.
Yeah, let's reschedule for next week. Unless you guys want it, we could do it tomorrow or next day, whatever. What do you guys want to do?
I think it depends on Dr. Conan's availability.
Yeah. And the
Okay,
ability.
so it's usually every Saturday, right? So I can do it next Saturday. So what I will do, I will send you my PowerPoint, Eric.
Yeah.
And Zolo, my PowerPoint today. So we will reschedule for next Saturday.
Perfect. That'll be awesome. It's unfortunate. We really wanted to hear a lot about this. We even have Dr. Nuru calling in. Dr. Nuru, how you doing?
Hi, Lyric. It's a long time. I'm doing well. How are you?
Yeah, fine. You're back from France, are you?
Yes, I come back. It's not easy, but
yeah,
I should come back. So I come back.
You ran away from COVID.
I don't have time. The one
I think you can run away from COVID from anywhere.
Okay.
Can't run anywhere.
So Dr. Nuru, are you in Rabat now?
No. I am in France. I come back Wednesday night.
Okay.
I was in Senegal because I was going to Rabat, but after I go to Dakar and finally with Ambassade of France and also my chief here sent the certificate that I should be in France to work. So they do all they have to do. I find the flight, but
okay.
I pay the fees, of course. So I come back Wednesday night.
No, you're lucky. You're lucky, man.
Okay. Stay safe, Dr. Nuru. Stay safe.
Of course, I don't have time. But
Yeah.
neurosurgery is so down, so we didn't operate like next month, last month.
Mm.
Is,
Yeah. Yeah.
Nice guys, Dr. Marco Meloni, how are you doing? I'm so
Yeah, he has a good story. He has a
sad.
really
I'm
good
so
story.
sad.
Man.
I'm
He's
so
in the
sad,
epicenter.
We are with you. Don't worry.
Thank you, guys. You're very, very kind, and I appreciate it a lot. Thank you.
You are welcome. Natalie, how are you doing?
Yeah, I'm okay. I'm okay. Just there.
You like a residency course?
In Ivory Coast. Yeah, it's very interesting, and they're well organized. It's nice. Maybe one day, I don't know, I'll do a presentation on my experience here. It's nice. It's very, very, very interesting. We have great mentors like Dr. Landry Conan.
Good. So you have to. Okay, nice. But who is Christelle? I find another Christelle. It is you also, Christelle?
My name is Natalie, and then I have a second name, Christelle. So
okay. Because sometimes I was confused. I said, who is Christelle? Who is Natalie?
It's the same person. It's
Okay.
the same person.
Nice. Okay. But unfortunately, we can't have presentation today. I don't know why.
No, I think it's a connection issue. That Dr. Landry promised us that maybe next week you do that, because it was so interesting, but we couldn't get him very well.
Of course. Okay.
Yeah, it was just too bad. Just too bad.
But
We tried.
I didn't see you last time. You what happened?
It is so long time. I've had a few things going on here, and it's been a bit difficult finding the time to but
okay,
we'll be fine. We're getting back to it.
Nice to see you.
No, always nice to see you, Dr. Nuru. I'll just take this time to just put it out there. If you have a presentation on any topic, please get in touch with Ivan Zolo. Zolo has been handling very well the schedules, and we can schedule presentations. We don't have to present always on Saturdays right now because, you know, COVID is out there. So we can present almost any day and every day.
Yeah, we can present. We can present. Yeah, we can present anything you guys want.
Yeah.
Anything you guys want.
So if you have anything you want to present, please get in touch with Zolo and we can schedule it as soon as possible. This was really an opportunity for us to learn. So
yeah, yes, and we have to improve on this in the presentation and in our preparation, because we're learning. But I'm glad all you guys tried. I mean, it's better to try and fail than not try. So because we're learning something. I think maybe before the next, we got to measure the speed of the internet of the presenter, and let me show you a platform that does that. That we can. You know, it kind of tests the internet, the speed, and I'm going to share my screen here. I don't know if you guys probably seen this site, but it tests the speed of your connection, and we have to adhere to this because otherwise we'll end up another day like today. Okay, you see this website is speedtest.net. Okay, and it basically measures the upload and download of your connection. And if it goes below a number, we'll have problems like today. Don't go by this speed, this is mine. But the download speed should be at least 2 to 5, and the upload about 5, okay? Otherwise, we really have to be careful or make some special allowances or whatever. So Zolo, and I don't know if Ulrich's gonna check, but someone needs to check the connections of the presenters. Okay. Yeah, Zolo, you got that? Did you hear that, Zolo? I think I talked to you about it before. But it would help.
Yeah, Dr. Ben. Yeah,
get that website address and just ask the presenter, could you please tell me the numbers? Could you please tell me the upload and download?
All right.
And
I'll be doing
just
that.
let me know the numbers, okay? If you're not sure,
Okay.
say, are these numbers good?
Okay.
There's no guarantee, but I mean, we'll have an idea.
Yeah, actually, what I thought since they're in the same country, Dr. Natalie, and she presented last time, the connection was really good. So I thought it would be better than Cameroon. But
Yeah,
okay.
I'm glad he tried. I'm glad he tried.
But
At least we tried.
maybe Dr. Landry wants to try again because
Okay, why not? I'm fine.
Let's start by measuring the speed, maybe.
Yeah, okay,
Yeah.
okay. Let's see, Dr. Landry, you there? Hello? Everyone can do it to see if they're curious about what the speed is. Landry, are you there? Oh, okay, good. But okay, you're gonna try it, okay? I don't think, okay. No, it's falling off again. It's not even worth, I don't think it's worth it. Dr. Landry, could you run that speed test on your computer, please? Can you hear me? Is anybody communicating with me?
Yeah, we'll try and get in touch with him through WhatsApp. So John, I think the best thing to do would be to have a document on like the test prep things before a presentation. Like say the presenter should be available at least 15-20 minutes before the presentation, get tests of the speed, have the presenter share that presentation right before, at least 15-20 minutes before the presentation with one of the panelists, so that if there's a problem with the connection, we can always have them speak while we're sharing we're using the presentation.
Yeah, or we can ask the person to move to a place with a good connection, or try a different place.
Well, trying different places now is a bit difficult, with COVID, isolation. So
yeah, right. Well, sometimes you have a friend or something, or an apartment or something. I don't know.
Yeah, so Dr. Conan says he can't hear us. This probably just, the connection is
it is insane. So yeah, sure. If you want to write that up,
yeah, we'll work on that.
Are you ready to work? Are you ready to work, Ulrich, or you ready to do some work?
Ready to do some work.
Yeah, like getting people ready for presentations and stuff. You've been on vacation for a while.
I've been working. I haven't been on vacation.
Okay, whatever. Sure, if you're ready to work. Let's get get that protocol set up and test the speakers before they start. Sure, write a protocol up. Okay, well, I guess I'm okay.
Yeah.
Yeah, we'd like to apologize for all the breakdown, and hopefully next time is going to be better.
Well, at least we tried. At least we tried.
Our appetite was wet, and we are hungry there.
Yeah. So let's see who's there.
Okay, I think if possible, we could share our experiences with COVID, like
that would be cool.
Yeah, Dr. Ulrich, how is it going on your side? Like, how is it affecting you?
Well, Massachusetts is hit by COVID, like really hit by COVID, so it's a bit difficult. It's been really tough working from home, every once in a while taking call. So yeah.
Sorry about that. And
well, New York is getting bad. New York is getting
oh yeah.
The center of it. So it really hasn't hit Boston yet. Hard.
Yeah. I would say it has, but the governor has taken some pretty drastic measures, not as drastic as those in New York, but
yeah. Well, Miami's starting to limit when you can go out of the house.
Mm.
There's the food trips, medical trips, is about it. How are things in Italy, Marco? Are they getting better at all?
Oh, well, currently there is some little good news. The admission are decreasing and the discharging home increasing. So things going a little bit better, but there is still an emergency situation. So we cannot we cannot say everything is going good until we see a dramatic increasing of admission. So is not worsening, but it's not getting better.
Right. Well, it's supposed to be slow, right? The disease itself takes a while. The disease course.
Yeah, of course, because I consider that the incubation time of this virus is 2 weeks about. So we see now the people infected 2 weeks ago. So now the measure, the restriction are active since 2 weeks about. So logically now we could see the a decreasing of incidence of infection. I hope then some people, few people, but still continue to do what you want to do. So something can happen. And another problem is the South Italy, because I don't know if you saw, but when the North Italy begin the infection, a large part of people born in South Italy but work in North Italy move back home. There was an immigration on South Italy, a very huge immigration. So the problem is this, that in South Italy could happen an increasing of case. It has a
yeah.
How is the situation in Africa, guys? I hear there is some news I hear about Corona in Africa.
A few countries have registered cases. Great cases have been increasing in like Nigeria, South Africa, a drastic increase in South Africa. Other countries are seeing cases pretty much along the same trend as was seen in Italy or the rest of the countries. But at the moment, it's nothing. It's not exceptional. It's just like the average that we've seen everywhere else in terms of trends. But the problem now for Africa is social distancing is a bit difficult because you have a lot of people that get money every day when they work on that day. So they get the money for that day on that day. So when you ask them to do social distancing, it's like, I'm going to go to my house. How am I going to get money? So that, I think that's the big question. How do we handle that? We can't just tell everyone to go home.
Yeah.
For example, in Dakar last week when I was there, it is very difficult to tell people to stay at home. They can't understand that. It is very, very difficult because in Africa there are many people so far. They don't have. They like you say, every day it is pain and gain for them. And now I think today they increase the cases to 100 cases, and I think just 12 people go back to their home. They are free now.
Mm-hmm.
But many cases, I think also they didn't increase the incidence peak also. So I hope in Africa we will not have a lot of cases because we don't have means to handle this situation. If we have cases up than 1,000, 2,000 per country. It will be disaster. So we hope, but something I see is many countries take big decision at time, because we see with few cases they close the school, they close many things, they close the airport. I think maybe with all these means, all these decisions, maybe we will not have a lot of cases in Africa. But that we can manage that easily.
Personally, no, because the cases are already there, and we have a big problem of with education. So, and as Ulrich said, people can't really for like here in Ivory Coast in Abidjan. I think people were just living their lives as normal as if there was nothing, because and people don't even understand. They don't understand the measures taken, what is said to be done. So people don't really face the emergency about the COVID. So it's really difficult with our how can I say, our beliefs. Again, people prefer going to church now. They say it is the devil, this kind of things. It's really complicated, yeah. It's really complicated.
I understand, Natalie. In South Italy is the same. Some people back home, then in South Italy, then they organize a party with their old good friends, and we got 40 new cases. It's terrible.
I second Dr. Marco on that. The truth is, it's not spatial. Like, Africa is not special in that sense. In the US, for example, you had people who were going for spring break. People were like, oh, now we're not working, let's go for spring break. It's like, well, you're not working because there's COVID. Why are you going for spring break? Just imagine that a lot of people going on the beach, showing their muscles out, greeting each other, drinking beer together. The same thing happened in Australia at Bondi. So it's not just Africa. It's people don't measure it. Yeah, South Italy as well.
So it's a worldwide.
It's a worldwide problem. It's not just like Africa has the problem. Yeah. Africa. So 3 weeks ago, there was the director of Africa CDC, who was here at Harvard School of Public Health. His name is John Kengasong, and he said basically that when the first cases came up in the world, in China, what they did was Africa CDC identified 2 centers. One of them was in Senegal, and the other one was in, I think, Senegal. So what they did was they selected a number of centers around Africa, 48 of them, and flew out the different personnel from these centers to go and learn from Senegal how to diagnose COVID. So he said in December, Africa only had 2 places that could diagnose COVID. Not because there was not the equipment, but the techniques. They didn't have exactly the techniques specific to COVID. Exactly. So now that they've done it, there's like 48 of the 50-something countries have the capacity now to diagnose, which is fantastic. So I know it always feels like in Africa we're not doing enough, but I think a lot has been done already. And actually, a lot of African countries have had better reactions than a lot of the European countries. Like, a lot of them were like, yes, let's stop the business, let's stop travel and all that. But in the US, I don't know if you've been watching, it's crazy. You listen to the president of the United States and he's like,
yes, it was relaxed. I think he's relaxed.
Yeah, he's like, you know what, folks, I don't know. Not that bad. Not that many people will die. It's like, what?
Have you heard about Boris Johnson, United Kingdom?
Oh yeah.
It's terrible.
Yeah, what did it say?
And now he's in COVID positive himself. Terrible.
Yeah, well, I'm not defending Trump.
But you are defending him.
No. Don't expect me to defend him. He's saying one of the Anthony Fauci, who was a doctor that fought against AIDS. He was a big doctor against AIDS. he's contradicting him on national TV, and he refused. Like he really needed to declare a state of war in New York to get the materials in because it's taken so long. And finally, it kind of like it's called a Korean Act, where the president can do anything. He can tell a company like General Motors to make ventilators, which he did finally. They didn't like to do it, but the General Motors is now going to make ventilators. But I'm kind of afraid with Trump in charge, what's going on. Hopefully, thank goodness there are other Czechs and other people involved.
Yeah.
Vocal about it.
Yeah, it is really, we're assisting, we are all of us are assisting the failure of our governments. Like the governments everyone was criticizing China, right? Like a month ago, oh, it's an authoritarian government, they shouldn't be doing this, blah, blah, blah. Now, look at them.
Yeah.
And everyone else is hesitating. Everyone is like, should we do it? Shouldn't we do it? In the US, every state is taking the law and it's so different. And the problem is we're all interrelated. So if there's still a case in like the US, even if Italy takes care of all its cases, it can't just open up its border because people will travel to the US, people from the US will go to Italy. So we're all affected. If we don't act the same way, we're just going to be messed up. So it's sad, yeah.
Yeah, and I have a question. Like, yes, we all speak about the sad part of it and how disastrous is it. But what can we actually do? Like, what is the way forward? Like, what can be done to put an end to all this? Let us just be like brainstorming it. Like,
so Zolo, that's a very good question. Normally in this situation, there is at the WHO, there's what you call public health emergencies of international concern. So if you check on Google, you can find it. There's an entire protocol on how countries should behave when there's a public health emergency of international concern. You're supposed to report to the WHO real time, and they're supposed to coordinate so that everyone has acts towards the same goals. But unfortunately, every government is trying to do their thing. So you see some governments are able to like test massively. Other governments are like, we're not going to test massively. Let's have everybody get infected and hopefully get to a point where nobody's getting infected anymore. So it's just different, you know. And one thing you learn is if you're going in the trenches, if you're going to war, you need a unified command chain, right? You need everyone to do the same thing. Otherwise, no matter what the intentions or the efforts are, you just make it more difficult for everybody. And that's what we're seeing here. It's lacking leadership. There's no two countries have been like, hey, let's try. Well, Italy has done it with China and Cuba, for example, but the rest is like, yeah, everyone is doing their stuff alone.
So I have this for Dr. Marco. What about the use of chloroquine? There's a great debate about the use of chloroquine and azithromycin, the treatment of corona. Well, how is Italy taking things? Have they started using? Are they even having, how can I say, the intention of using it for their patients, or they are just managing as they can?
It's just a story. I don't know. Is it being used, Marco, in Italy at all? Chloroquine? Are you there?
Hydroxychloroquine. Oh yeah. Oh, we are attempting a protocol about the use of Plaquenil, the hydroxychloroquine. Exactly. In some center, like in Naples, they tried, and the people was able to be extubated in a fast way. Now we try the same protocol in my hospital. We just started 2 years ago, 2 days ago. So I hope to see some results.
Yeah.
But at the first glance in Naples, there were a very good result. The people was able to be extubated if the therapy started at the first, not when it's too late. When it's too late, therapy seems not able to save patient's life.
Yeah.
But when you start in the early time, it seems to be able to reduce the RDS, the respiratory distress syndrome.
Yeah. Well, obviously there's not time for trials now, so they kind of have to go on anecdotal evidence like you're talking about.
Yeah.
You know, if it works, let's try it. It's an emergency. You know, what can we do?
Yeah.
How about Motrin? You guys heard about Motrin at all? You should not take it. Have you guys heard anything like that?
So again, with all these things, there's a lot of information coming out there. And
Yeah, like Motrin. Motrin's a big story.
The level of evidence, unfortunately, is anecdotal because it's coming out of institutions. So there's not much you can do about it. It's like, I guess you have to see what works with your institution and what works with your own country, what's available to, because that's another question. Is it available?
Here, I know that in France, one team in Marseille, and I know him well, Professor Raoult, who many of my colleagues was in his center about infectiology center. They use this protocol azithromycin with chloroquine, and that work very well. But
it
like
well.
Marco Meloni say, you should start the protocol before you have severe stage. So when you start that first, they have a good result. And also in Senegal also, they start that. In some country like my country in Benin, they start also that with apivirine. And but all that, it is like you say, Ulrich, it is protocol. They start that, but I think who can't now official take it like a like a universal protocol, but I think they should make more effort and show more evidence like that, so we can take like universal protocol to cure that. Because you know also there are many research investigation for vaccine for the cure to prevent the COVID also on way. So, but now I think that is not bad. It is not bad to try the first stage of this of COVID.
Yeah.
Consider the pandemic started 2 months ago. It's too early to say. We need to attempt because we're in a crisis, and so we need to attempt logically how's the use of hydroxychloroquine and see.
Exactly.
So,
yes. Yeah, there's a shortage of chloroquine now in this country. It's hard to get it.
But me, I have one philosophical point. I don't know if you see that nowadays, how all of them in the world, we are talking about just one word. We are stay all together to fight coronavirus. I don't know if you see the message that this situation make us, because I hope after this, we will be always strong together. We will not, after coronavirus, we will stay again in the war, China with USA. I don't know, many countries always fight. I hope after this, we will stay safe. We will always be together, and because we are just one world. So I hope we will win this war, and we will stay together forever.
Yeah, well, let me paint one scenario. Imagine if China's supplying us with ventilators, and there's going to be a shortage of ventilators in America. It would be funny if China supplied a lot of ventilators and we became friends after this. Wouldn't that be funny?
Why not?
I guess that for the first time in the several years, for the first time we got a problem that is not a political, a religious problem. It's a problem of healthy and regards every one of us. There is no political distinction.
No color,
It's a human problem.
Yeah.
Exactly. Exactly.
Yeah. Well, I've shared the link to a very good course offered by Johns Hopkins on Coursera for free. So if anyone wants to learn more about COVID and from trusted sources, you can click on that link and take the course, and you can get a certification at the end. So why not do it?
Good.
Is anybody seeing patients with corona? Anyone?
Yes.
Oh, okay. Can you describe them? Like they come in with temperatures, sweating, fever. Any other complaints?
Favor and brave. How can I say that? Case that me, I think they go directly to intensive care.
Yeah.
And they are directly put.
So they deteriorate rapidly.
Intubation. Yes.
Yes.
But also I didn't. I think next week I will do. I will help the center here to do. To go to the. We call that. It is like a tree. We go to see all the patients who we have to take in hospital to hospitalize, or who have to go in intensive care.
Triage.
Yes, triage. Yes, we do that. I think I should do that next week. It's not. We do that. It's not all days, but one day, because we are in neurosurgery department, and also in our department we take some places for the COVID patient. When other department will be full, we will take them, and also some cases who going out intensive care sometimes come in our unite continue center care in neurosurgery. We take them also, but we are not always with them because it is medical problem. So we take we take distance with that. So it is always intensive care who manage that, and infectiologist. But it is really sometimes it's really you can be scared about this because I have colleagues here who have been infected. It's not good.
Mm-hmm.
Yes. You should pay attention about fever and cough, and when you have difficult to breathe normally, you should go to test to go to the hospital.
Yes,
how about the health professionals? Have you seen them get a lot of them get sick in the room?
Here,
people working with patients.
I receive every day the point of the situation in my mails here. Normally it is confidential, but I know that in here we have like 20 people. I think yes, I think 20 people who was affected.
Okay.
Yeah, some statistics say around of all the infected people with COVID, like 12% of them are health professionals. So it's really sad.
Exactly.
Okay.
So we should.
I saw even 20% today.
Oh,
professionals.
20%.
Yeah,
there's a lack of equipment. I know.
But pay attention, guys, because a situation when healthcare can be infected is it seems stranger, but is in underwearing moment. When you come in a COVID department, of course you got all the protection, mask, glasses, gown, but when you get out from the ward, you need to remove this. Pay attention, because this is the moment when you can be infected. So use for every step of the underwearing the disinfectant gel. So you leave the cover and use the gel. Then you remove this, the mask, use the gel. I got a protocol we use, is very efficacious, and it prescribed to use disinfection every 2 steps of the underwearing protocol.
Okay.
Yes. You're right.
Thank you. Okay.
Don't touch your face. It's very important.
Yeah, it is very important. Yes. Okay, nice. I see one guy. Go take Jolo. Do you come from Benin?
Yeah, I come from Benin.
Ah, okay. Because I was seeing, I see the name. I say maybe I know you, maybe, but this name I think is come from Benin. Okay, nice to meet
We
you.
don't know each other, but yeah, yeah, I come from Benin too. I'm in Abidjan.
Nice to meet you. Nice to meet you.
How are things in Benin? How are things there?
Yes, but where are you now? You are in Ivory
I'm in
Coast.
Abidjan. I mean, I
Okay.
request. I'm in my fourth year of residency here.
Okay. So you are with Natalie.
Yes, I'm with Natalie.
Okay, good.
Dr. Conan and
welcome.
Okay, I know your senior Benin Beninese who was there, but I think they normally
Alberic?
one of them should finish. Yes.
Alberic, yeah.
Yes. Ah, you know Alberic?
Yeah, Alberic is my big brother.
Okay, nice.
Alberic.
My
He's in
like
Amiens
my
now.
brother also. We are always okay. Nice. Okay. Good. Okay. I will keep you in touch. Don't worry.
Okay,
Just
let's keep in touch.
just for a joking matter, there's someone who said, I think we should re-download 2020 because there's a virus who just installed itself in 2013. So I hope the re-downloading we get
Without the virus. We download it without the virus. It's very
without the
important.
virus. I think we will download 2020. Okay, guys. Thank you very much. I have to leave you. Sorry.
Okay,
So,
Natalie.
Me
Bye.
too. I have to leave.
Bye-bye.
And thank you very much, guys, and have a nice weekend. And me, I have shift this weekend. Yesterday and Sunday. Today it's just my day to rest and to work a little about my paper. And tomorrow I will go. I have to go back again to shift.
Okay, thanks for coming.
Everyone, and thank you very much, John, Marco, Natalie,
take
all
care.
the team.
Let us know when you want to present.
Next Saturday.
Okay. John, I think.
Okay, bye everyone.
Hey, Ulrich, are you there? Yeah, I'd like to talk to you after, okay?
Sure.
Yeah, I'll ping you.
Everybody go off now.
Okay, bye everyone.
Bye everyone. Bye guys.
Hey, John, please don't go. I'm trying to download the message. So if you get off, I won't be able to download it.
Oh, no, I'm here. I'm here.
Okay, thank you.
Yeah, sure. Igor, where are you from? Can you hear me, Igor? Hello, Igor? No, you're not there. Perhaps. Odorinde Funzo, are you there?
Okay. Let me just do it.
Perhaps there is some connection problem to the audio cannot hear.
Are you trying to download something, Natalie? Is that what you're trying to do?
Okay, it's okay. Let me just put it here. This is the Google Doc of Dr. Conan's work. So he said on Saturday, next Saturday, you'll be here. So we shall meet next Saturday. And I wanted to tell Dr. Marco that I felt really touched that he's really taking pleasure being part of us and doing presentations. I'm really touched by that.
Oh, thank you very much, Natalie.
Yeah, Marco's helping this group.
Yeah, he's become an African.
Yeah. No, he's like the mentor. You're the mentor of this group, Marco.
No,
Yeah.
The big board.
Yeah,
You are a mentor to a continent.
he's a great mentor indeed. He's a great mentor. Okay, I have to leave you guys. Bye-bye.
Thank you, Natalie.
Bye, Natalie. See you.
Bye-bye.
Oh, wow.
I can.
So you're staying at home, Marco, huh?
Yeah, this week I stay home. I go night shift in the emergency COVID ward in Monday.
Oh, okay. So you work a regular, like a 12-hour shift in the emergency room? Or?
Emergency and the ward of COVID. I
Okay.
do also on call for neurosurgery problem, but usually they are very not a great case, because the most part of pathology, neurosurgical pathology, is moved in the Milan hospital. So in the north part of the region, the emergency case of neurosurgery are moved in other hospital, because our hospital is dedicated the most part for coronavirus cases.
Is that the one place in Milan that is, or the more?
Niguarda Hospital, the most part.
Yeah.
Is called Niguarda. It's one of the biggest.
How's your girlfriend doing?
Oh well, she's fine. She's fine, but very exhausted because
she's a doctor too, right?
Yeah. She's an internal medicine doctor.
And so she's seeing a lot of patients.
Yeah, a lot. Her department is dedicated to most part of case in Milan. Yeah, she's dedicated to coronavirus patients most part.
Okay.
In fact, their hospital is the first one. Is the San Rafael Hospital. Is the first case in Milan is in her ward, and her ward is the first in Italy that planning the use of hydroxychloroquine.
First place to use it.
First trial for national.
What does she say about it?
What she said? You mean
about chloroquine? What does she say about that?
Well, it said that if administered at the first glance, it seems efficacious.
Really? So are they using it for all the patients now that fulfill that?
For patients that don't have a contraindication, because there's a pharmacs that has some problem, like people affected by anemia or of medullary problem.
Okay, but there's not many contraindications, right?
No, not a lot. Unfortunately, not a lot.
Okay, so it's generally accepted by the doctors there to give it to patients.
Yeah, usually is well accepted. It got some collateral effect, gastrointestinal, bowel effect, but is usually well accepted.
Well, I don't know what they're doing in Miami because it's so out of touch with everybody. They could be doing that in the hospitals here now. I just don't know about it. I don't have any touch with them. But well, it's interesting to find out. And no one heard anything about Motrin. Like Motrin is, like it's a pill. It's like Tylenol, but it's ibuprofen. Here, there's a lot of talk of it causing worsening. That if you take it, it worsens quickly. But that could be just a story. I don't know. I'll have to look it up. But the video, have you seen some of the video? I think I sent you the video. Oh, you saw the video from New York.
Yeah. So
that's scary. That's scary. That was 2 days. That was 2 days ago. I wonder what it's like today. Probably it can't be better. It's got to be worse.
Yeah, Times Square is completely empty.
Yeah.
And in this hospital, I saw people without mask. A stranger.
Yeah, yeah. Well, you know, the place to get the true story is the doctors, because the politicians, you can't just can't believe them. And what the picture they painted, the ICU doctors, was pretty grim in New York. And that's fast, man. I was surprised. I knew it was coming, but I was surprised it was so fast. Boom. In New York, just in like less than a week. Boom. It's paralyzed the city, New York.
It seems a very contagious virus, this one.
Very contagious, huh?
Contagious.
Yeah. Wow. Well, okay, very good.
Yeah. Let's up to that some measure, even if strong measure, will be done to avoid other infection. That's happened in New York and in United States. Is happened the same thing happened in Italy. At the first glance, it was a situation where you move right, left. You say, "Oh my God, what can I do right now?" But then when they found the brave to say, "Let's lock everything. Let's stop all the transport from north to south Italy, from Lombardia to other region." Situation going less worse.
Really?
Expect.
Okay. Yeah.
So I think United States need to do the same things. To take more care than usual, to measure like washing hands, don't touch the mouths.
Yeah, wearing gloves like this. Yeah. Just to touch doorknobs in public, public places and stuff, which makes sense. I mean, if it's a contagious thing, it's probably on doorknobs and metal, because it lives a long time on metal, the coronavirus. And a lot of doorknobs are metal doors. You know what I mean? Little things like that probably add up. All these little risk factors and the virus hanging around.
Yeah, exactly.
So, yeah, just kind of hanging in there, and it doesn't affect me. I'm at the computer anyways. So, what are you doing, Marco? Are you exercising a lot?
Yeah, physical training, and now I've defrozen my chicken wing, so I do some desk microsurgery.
Oh, really?
Yeah.
Oh, wow, you practice that, huh?
Yeah.
Are you doing any reading at all, or you don't like to read?
What? Sorry.
You doing any reading?
Oh,
like reading a book, Lier. Reading.
Yeah, I understand. I understand that.
Okay.
Well, no, this is practice, because now I used my microscope, my iron.
Oh, okay.
And, I attempt to suture a little artery of the chicken wing. I'm defrosting right now.
What do you find when you're away from it? You lose a little dexterity.
Well, I read a book. I talked about in my last panel about coronavirus, is getting ready from brain tumor. It's very interesting because it describes many things to exercise at home in neurosurgery. One is this use of chicken wing. Isolate the artery and attempt a suture. Other, like use of a colored substance to simulate a tumor into a animal brain. You know, the brain usually sold in a meat shop. So it's very interesting, like a book. And then getting some information, I found this microscope is a $400 with all the set, iron set, and some suture for a microsuture 9.0. So I've organized my own microsurgery desk.
Wow, you're going to be so good.
Yeah, very exercise. Yeah.
Well, that's the way I look at it. If we can do something positive and get stronger while awaiting to recover, it's the best thing. I mean, to just work at something, work at something while we're isolated, so that when we emerge, we'll be stronger in that area.
Yeah, of course, I got more time to study, but sometimes it's psychologically hard because I miss surgery. I miss to do.
Well, that's one thing I say to a neurosurgeon when they say, "Oh, things are rough and this and that." I said, "Do you like to operate?" "Yeah, I love it." They all say the same thing, and they snap out of the depression right away. You know what I mean?
Yeah,
like,
yeah.
This is a hard life. Someone from Pakistan was saying it's a hard life, and I work 120 hours. I say, "Hey, you like to operate, right?" "Oh yeah, I love it." then there's their answer right there.
Yeah, I saw a cabaret clip I posted in my Facebook page. It's very, very funny. It's about brain surgeon. It's very funny. You can.
Oh yeah.
You just have a look. It's very, very interesting. Very, very funny.
Wow. Hey, I have a question to ask. Well, it was Ulrich. I was mad at Ulrich because, by the way, we're alone now and we're not on the air. I like that.